Good evening, everyone, and welcome to our third New York State Vaccine Equity Fireside Chat. My name is Louise Square, and I am the Health Equity Coordinator for the New York State Department of Health AIDS Institute. I'll be your moderator for the evening, and we're just going to go through quickly an overview of what the hour will look like. Next slide, please. So we're going to have a welcome, and I'm going to go through some housekeeping tips for you. We'll have opening remarks, a panel discussion, and then Q&A. And then after that, we'll have closing statements and a thank you. Next slide, please. So housekeeping rules. To ask a question, please use the Q&A feature. Type your questions to the Q&A box and then tap send. Replies will be seen in the Q&A window and may be answered either live or out loud. If you need assistance during the meeting, please contact privately a staff co-host through the Zoom chat feature. You have access to two forms of communication during the hour, the chat and the Q&A. So what we're asking is that you put your questions in the Q&A. This kind of makes it a little bit easier for the panelists and I to see the questions. So next slide, please. Now we will have opening remarks from Pat Long, the President and CEO of Health First. Pat?
Thank you so much, Louise, and good evening, everybody. It is my pleasure to serve as one of the co-chairs of the Governor's Vaccine Equity Task Force, and I am very delighted to welcome you tonight to this evening's Fireside Chat. As many of you know, health experts, especially physicians and scientists, have projected that we need to reach 75 to 85% vaccination rate within the entire population in order to win the war against COVID. As such, New York has made it a top priority within this vaccination effort to ensure that diverse, vulnerable, and underserved communities are not left behind for their own sakes, their families' sakes, and the sake of the community at large. The Vaccine Equity Task Force was created to try to support that effort. It's comprised of many deeply knowledgeable people from around the state who come from their own communities. It's been focused on effective communications in language that can actually reach and be understood by the community, public service announcements, and the like, including identification of local vaccine sites so that in many instances the vaccine can be brought to the community rather than making the community perhaps get to inaccessible mass vaccination sites. So on behalf of all task force members, I really want to welcome you to tonight's incredibly important discussion around the history and the science behind the vaccines. And I'm very much looking forward to hearing the two esteemed physicians who are going to talk to us about this tonight. I just want to say that even if you yourself are not yet eligible for the vaccine, it's very important for you to have this information because you can counsel your family members who might be eligible, your friends, your family, and the rest of your community. So I thank you very much for joining us and listening with open ears. And look, I will turn it back to Louise and look forward very much to hearing the comments of the two doctors. Thank you.
Thank you so much, Pat, for those opening remarks. Next slide, please. I'm excited to have this opportunity to have a conversation with two highly respected clinicians who have dedicated their time and energies to the service of underrepresented and underserved communities. Both of our distinguished guests have extensive and impressive bios, so we had to condense them a bit for the sake of time. First, let me introduce Dr. Wayne Riley. Dr. Riley is the president of SUNY Downstate Medical Center, which is the only academic medical center serving Brooklyn, New York, one of the most diverse communities in the nation. Prior to joining Downstate, Dr. Riley served as clinical professor of medicine and adjunct professor of healthcare management and health policy at the Vanderbilt School of Medicine. Dr. Riley was most recently appointed chairman of the Board of Trustees for the New York Academy of Medicine, whose mission is to influence and encourage action in urban health, focusing on achieving health equity in the areas of healthy aging and disease prevention and the elimination of health disparities in general. He is the first African American board chair in the organization's 173-year history. He is the recipient of numerous awards, too numerous to mention this evening. Next slide, please. Dr. Raul Vasquez is best known as the founder of Urban Family Practice and G Health Enterprises with his wife, Mrs. Tony Vasquez. Having come from humble beginnings in the Bronx, New York, Dr. Vasquez understood that something dramatic had to be done to confront the challenges presented by a healthcare system rooted in reactionary care. Dr. Vasquez posited that reactionary care is as problematic as it is unsustainable when the outcomes prevent economically distressed communities and communities of color from receiving coordinated healthcare management delivered in a cost-effective and cohesive manner. Dr. Vasquez has been invited to speak at some of the most prestigious universities and conferences in the nation. Thank you both for being here. So during our conversation, we plan to talk about the information many of us still need to make an informed decision, including exploring the historical context and the science behind the COVID-19 vaccine. We are inviting our guests to share their knowledge as well as their experiences. Most importantly, we want to share information with our panelists that will help them in their decision-making process. We only have a short time to be with you, so we're going to jump right into the questions. So my first question is, people want to know how the COVID-19 vaccines prevent someone from becoming infected with COVID-19. I'm going to direct my question to Dr. Riley first.
Right. Well, good evening, Louise. Thank you for you and all the great work you do at the New York State Department of Health, all your colleagues who have been working very hard through the last year to protect and serve New Yorkers. So my hat's off to all of you at the outstanding New York State Department of Health. That's first great question. Vaccines are sort of one of the time-honored ways in health and public health and science that we try to protect and prevent diseases that are infectious, meaning that they can pass from person to person. So infectious diseases are different than other diseases such as heart disease, strokes, hypertension. You can't get those from other people. But infectious diseases, you can get them from people. And that's what vaccines try to do. They try to prevent you from getting an infectious disease. Or if you do get it, you'll get a very mild case of the infectious disease. Now, the bad part about infectious disease, Louise, is that infectious diseases do kill. For example, everybody knows about the flu. The flu kills about 50,000 people per year, whereas now COVID will kill, by the next month, kill 500,000. So you can see that COVID is 10 times more deadly than the flu. And it's an infectious disease. It could spread from person to person. So that's why we use vaccines to try to decrease the amount of person-to-person spread of an infectious disease like COVID.
Thank you so much. And so I'm going to ask Dr. Vasquez to comment on that too, but I'm just going to add a little bit to it. How effective are the vaccines at doing just what Dr. Riley just explained, keeping us from becoming infective? How effective is this vaccine?
Yeah, so this, especially the two that we have, which are messenger RNA vaccines, the Pfizer and the Moderna, both are ranging anywhere from 94 to 95%. I think because of the technology that's being used with these vaccines, that's very, very, very effective. The one thing too is that these vaccines do not contain any virus particles. I mean, so they're not, we're not taking the actual virus and either taking pieces or deadening it to create a vaccine. This is purely, we're using the actual strands, amino acids so it's a little piece of the actual piece that can make something like a spike protein of the virus that we're dealing with. And we're teaching the body to actually create those spike proteins and produce antibodies in terms of responding. So if you do get exposed to the COVID, you're actually protected. This is a a different way of doing things. And I think it's actually going to change paradigms in how we manage vaccines in the future and how we treat people. Because this technology, which has been around for 12 to 15 years, is now really being put out in the public this way. But it's showing that it really works well.
Thank you for that. Yeah, and thank you for mentioning how long the mRNA technology has been around. I think people obviously are not familiar with it and they have concerns about it. But thank you for addressing that. So I'm going to move to the next question. Folks have a lot of concerns regarding the side effects. We've heard a lot of side effects, a lot of different stories about side effects. Can you kind of walk us through them and address them like one by one? So, is the vaccine safe? What are the side effects? How common are the side effects? And both of you can answer, but I'll start again with Dr. Vasquez.
Yeah. So we've given 650 shots, and we've managed and looked at people during the time. Most of them have gotten their first shots. I actually, I've been vaccinated. I get my second shot on Monday. So we basically walk people through that process. Most of the time, if you haven't been COVID infected in the past, that's going to change how these vaccines react when you get them. But if you haven't, the worst that's going to happen is you're going to have a little pain or discomfort at the site of the injection. That's about it. And most people, out of the 650 people that we gave, about 590, that's all that they had. If you had COVID infection or in the past, then you develop memory cells. When you get this shot, it will give you the symptoms of almost, seeing that COVID is being exposed to the body again. Those individuals were getting not only the pain at the site, but they were feeling they felt down, a little discomfort in muscle, fevers. Fevers can range up to 102, 103. And that happened for 24 to 48 hours. And usually Tylenol, Motrin control that. And that's the extent of what we saw with the symptomatology of the actual vaccine. But again, the fact that now the individuals that get the shot the second time are going to develop the symptoms that I described, arthralgias, muscle aches, and fever. But that's telling you that your body is actually developed the memory cells and now is producing this antibiotic reaction, with the symptoms that you're getting.
Thank you, Dr. Vasquez. And Dr. Ali, did you want to add anything?
Yes, Dr. Vasquez was right on target. Side effects are normal for all medications. Dr. Vasquez and I could give you an aspirin tonight, and some of you would have a side effect of taking an aspirin. So side effects are not to be unexpected with any medication you take. The good news about the two vaccines that we know of right now is that the side effects generally are pretty mild. I too have had the Pfizer. I've had both my Pfizers. After the first shot, as Dr. Vasquez said, my arm hurt where I got the shot for a day. Didn't think about it, slept like a baby the night of. The next day, felt perfectly fine. Some people do feel a little run down for a day, but I didn't have any problem. Second shot I got after Christmas, same thing. My arm hurt for one day. The only other thing I noticed after the second shot was my nose was running like a faucet for 2 days, but that's it. And now I have the comfort of knowing that I have good immunity because of this vaccine. So the vaccines are incredibly safe, incredibly safe.
Thank you so much for that. And thank you for going over the symptoms. People need to know that that's what they're concerned about.
Mm-hmm.
You hear a lot of different things in the media. I'm going to go right now to Megan. Megan, you have a question for us?
Hi, Louise. We have a question in the Q&A from Patricia. She was asking, if the vaccine doesn't have virus particles, where does the mRNA come from? How is it produced?
So the actual MRI, it was produced in a lab. And what they did is they figured out the DNA sequences for the spike protein. So all this stuff was created outside to develop the actual code. And then they were three-dimensionally able to compare that spike protein with what the COVID-19 spike protein looks like. So we're fooling the body. And then, so you got this messenger RNA that gets put in a lipid particle that when you get it injected, it actually migrates into the muscle. And that code lasts for very short periods of time. And that's why the freezing component of it is so important. Once that code goes into the muscle, you have these ribosomes, these little things that read it, and they're the ones that create the spike protein that basically goes up to the part of that cell, and now it starts to trigger the immune response. But there is no virus in this whole process. We are technically fooling the body into thinking that it's being exposed.
Yeah, just to follow up on Dr. Vasquez, one way to think about this, Patricia, is that the mRNA is like an email. The email is sent into the cell and it says, hey, there's COVID around. Get the immune system, wake up immune system and attack the COVID. And that's what it does. And then after the mRNA does that email, just like Snapchat, it disappears. So it doesn't go into the body, which is the beauty of it. So the mRNA is like a messenger, a shuttle to bring the genetic code from that spike protein that Dr. Vasquez just mentioned, because in the spike protein is where how the COVID virus begins to replicate and do damage to the human body. So by just giving a little bit of the genetic code into our cells, and then our cells get used to it. The cells develop memory, the antibodies develop memory, say, oh yeah, we've seen this before. And then what that means that if you get exposed to COVID after you get vaccinated, your immune system sort of says, hey, no problem, we'll take care of this, we'll kill it, and you'll be fine.
Thank you for that. I like that. It disappears like Snapchat.
Like
Okay.
Snapchat.
Okay. So I have another question for you. It's kind of along these lines. And I don't know that we've had a clear answer to this yet. How do we know how long the vaccines will be effective for after the initial vaccination, and after the initial vaccination, will people need to get boosters?
Great question. Let me take a first crack, and then I'll need assist from our great Dr. Vasquez. Right now, the God's honest answer is we don't know precisely, but the preliminary evidence that we've seen, and we'll be getting more data along the way, is that in the near term, for at least 6 to 7 months, maybe a year, you're going to be protected. There's even some indications that the shots may last up to 2 years. That would be great, but we just don't know yet. So let's just take the worst case scenario. Let's just say it's only good for a year. Well, that's okay too, because you just get another shot next year. We get a flu shot every year. Now, our hope would be that one of the vaccines gives longer immunity, such as when you get an MMR shot for measles, mumps, rubella lasts many years. Dr. Vasquez gives those out every day in his practice. Such things as polio, you get polio once in your life and then it lasts lifelong. We don't think it'll be lifelong, but we do hope that at least it's a minimum of a year, maybe 2, because that's okay. We just get another booster shot or a shot every year like we get the flu.
Thank you.
And I agree completely. I think one of the things that people have to remember, when we give that first shot, we could build a lot of what we call IgM antibodies. So these cells are making temporary antibody coverage. With the second shot, we're probably developing more of the IgG. These are more long-term. Mm-hmm. I'm hoping, based on the data, that it resembles the measles, where you're getting long-term. So we're talking decades, not just a year or two. Mm-hmm. And I think based on the science and the response and following a lot of the titers now, that's what hopefully comes out of this. So I'm hoping it doesn't become like the flu, because the genome for this hasn't changed too much. Mm-hmm. The flu's there's always a different soup in there. Mm-hmm. And I think that it may be more than a year or 2 or 3 coverage after the vaccine. So that's what I'm hoping, and the data hopefully will show.
Thank you. Thank you for that. So next question. There are currently 2 vaccines being administered throughout the United States for emergency use. So they were approved for emergency use. What are the differences between the 2? And is one more effective than the other? So we're talking about the Pfizer and the Moderna.
Sure.
Yeah, I'll take the first crack at it. I think the best vaccine is the one available to you. I think, just,
Number one.
Because, it's very careful. You got to do that. I think from the sense of a primary care out in the field, the Moderna is better for us because of it doesn't require the high freezers. I mean, the timeline lasts for 30 days. When we break the vials, it becomes easier to store and deliver. And I gave the Moderna, so I'm going to stick to that
Mhm.
because that's the experience I've gotten. So I think that's the biggest thing. When these vaccines, the difficult part of this is for the Moderna is there's 10 shots in that vial. When I break that vial,
Mhm.
I've got to be able to give it within a
Mhm.
6-hour period. Otherwise, it's not as effective. So uh, for private offices and pharmacies, that's going to be an easier delivery model.
Mhm.
The Pfizer in the beginning, had a different distribution because it could have 5 shots, it could have 6 shots in the vials. So that was tricky. And while you have a pharmacist doing this, that can relate to an issue in our sector. In addition to the way it's stored and the time period that it has to be used, which is a little bit faster than the Moderna. So I don't know if you want to comment on that, Dr. Riley.
Yeah, a great point. I think the easiest way to understand the Pfizer and Moderna is it's just like Coke and Pepsi. Coke and Pepsi are both colas, but they have slightly different characteristics. And one of the characteristics that Dr. Vasquez just mentioned, the Moderna is easier for doctors, particularly in practices, to store because you can store it in a regular freezer. Whereas with Pfizer, it has to go to one of those sub-zero freezers or -70-degree freezers that only hospitals have. So the difference is in the storage and the administration. For example, the other difference, as Dr. Vasquez will tell you, if you get the Moderna 2-dose series, you get your shot today and you get your second shot 28 days later. But with Pfizer, if you got your shot today, you get it 21 days. So it has slightly different dosing schedule, but in the end, they are both mRNA vaccines. They are both 94% effective. They work in everybody, black, white, yellow, old, et cetera, people with pre-existing conditions, high blood pressure, diabetes, obesity, whatever. That's the beauty of these two vaccines. Now, we do have a third one that we heard about today, and I know we're going to talk about the J&J shortly.
Mhm.
Thank you. Thank you. So, Megan, I think you have a question for us.
Yep, we had a question from an anonymous attendee just asking about having seen a video on social media. Someone who was vaccinated mentioned that she had gotten Bell's palsy, and they wanted to know if this was an accurate portrayal or if this possible side effect is very rare and if the vaccine can still be considered safe.
Yeah, I'll take a shot at that. I mean, we did a town hall meeting on all our staff. So we vaccinated 150 staff, which majority Black and brown. So it's about 85% of the individuals. And we did a town hall basically discussing a lot of this information that's on the web. Bell's palsy comes up, it's sterility. I mean, you name it, they come up. We had people that had Bell's palsy and got vaccinated, so whether that can happen, we're going to have to look at that. But it wasn't a big incident at all. We didn't see any of it within our systems. And I think, it's just people have to, worry about, after a while, you have to look at the vaccine risk if it was, but we didn't see it. If you get COVID, hospitalization, intensive care, and death, the numbers we don't see, we don't pay attention anymore, where we're hearing 45 people are dying, 4,500 people are dying a day. It's just not, it's just it. So a lot of misconceptions, and infertility was the big one. People were like, well, I want to get pregnant. I don't want this. And it's just a lot of false information right now,
Yeah, I agree. You got to be careful listening to Dr. Google, as we say. Listen to Dr. Vasquez and a lot of his colleagues, because we know the data more so than on Facebook and so forth. But Bell's palsy can happen with any infectious disease, particularly viral diseases, by the way. So it's a rare phenomenon. Dr. Vasquez and I have treated it. We treat with steroids and vitamins and so forth. And most Bell's palsies go away within 3 or 4 weeks. So the point is, you got to think about the risk reward. Even if you're concerned about Bell's palsy, the risk is still low. But we're trying to prevent you from the risk of getting COVID, which in some cases you can't recover from. So again, please listen to your doctors, talk to your doctors about your concerns, but your doctors will be able to put this in context. And as Dr. Vasquez said, he's given over 650 vaccines to people in his community, and he hasn't seen a case of Bell palsy either. At our institution, we've given out 3,800 shots, not a one case of Bell palsy.
And I also want people to know that we've given 27,800 vaccines in this country. So, that's a lot. It's about 56% of the storage that we have. And we've rarely seen maybe 29 adverse reactions with anaphylactic. So if you're going to see something with this scale of a vaccination, you would have seen it by now, because a lot of us, and Dr. Raleigh will agree, 30 days after the second dose, if you're going to see something, that's when you see it. And I think by now, with those number of vaccinated individuals, we would have had adverse reactions really reported and really being seen a lot more than what we're seeing right now.
Right. Dr. Vasquez, I got to correct you one thing. We've given out 27 million.
Oh, 27 million. That's what I meant.
Not 27,000 in the country, 27 million.
I'm sorry. You are correct. 20. That's what I mean. Yeah. But it's a big number.
My colleague, yeah. But the point is, we've given out a lot, and there's been very, very few cases of Bell's palsy.
Correct.
Thank you for that. And I think, what you're saying is really important, because we have heard from other experts like yourself that if you're going to see an adverse reaction, you see it relatively soon. And while we know it's too early to know long-term if there would be any long-term reactions, but the idea is that usually you see some reaction pretty soon if it's going to be negative. So I'm going to go to the next question. The speed with which the vaccine was developed has been a cause for concern. People criticize that it has taken years in the past to develop a vaccine. If you're talking to one of your patients, one of your clients, and they have this concern, what would you say to them?
Yeah, let me take a first crack. Look, one of the worst things I think happened with this whole process is, I would say it should have never been called Operation Warp Speed. It should have been Operation Safe Vaccine. And I think we can be critical of the Trump administration for a lot of things. I think they misnamed it. Now, the reason why I say that, although this technology is new, it's not really new. It's been around since 1989. mRNA technology was first discovered in 1989. And then if you fast forward to 2002, 2010, when we had MERS and SARS, that technology was used to come up with a vaccine for MERS that we heard about in another part of the world in case it came to the United States. The good news is MERS and SARS kind of went away. And so we didn't have to mass produce hundreds of millions of doses of those vaccines because the MERS and SARS kind of, burnt itself out. So no, in reality, this technology, although it was called new, is not really that new, colleagues and friends. It's been around since 1989. The fact is, this is the first time it's been mass produced for vaccines, up until this point. So no, this is not new.
And one of the things I want to add to it is also, when these companies decide to make a vaccine, it's got to go through a whole process. And there's they spend about $1 billion putting it through all the steps. And then you may get in front of the FDA and say, this doesn't work, the study didn't work, and you have to go away. This time, the federal government funded it. So they're making the vaccine at the same time that you're doing all this stuff. So a lot of steps are taking place. So if it got approved, you already had X number of doses, it's already manufactured. So that's why, it was a little faster, because they almost got guarantees that it was going to, if it worked, it was going to be used. And if it didn't work, you didn't lose all that money.
Awesome information. So I'm going to go to Megan. Megan, you have another question for us from the audience?
Yeah, we had another question relating to some of those opposing viewpoints heard about the vaccine, and someone wanted to know, how is it possible to know the efficacy of this new vaccine when we have no long-term studies or data?
Well, yeah, we do know that efficacy is very simple. So in the case of Pfizer and Moderna, there were over 77,000 people who were in the trial. About half of that 77,000 between the two vaccines got the study vaccine, and half got a placebo, basically a shot of saline. And so all they did was just say, okay, of the 35,000 people who got one of the shots, how many got COVID? And out of 33,000, I'm sorry, out of 15,000 who got the shot, less than 20 out of 15,000 got COVID. Whereas the 15,000 who got the placebo, there were over almost 300 cases of COVID-19. So you just do the math. It's just a division thing, right? And so that's how we, in statistics, we say that's how we determine if a drug is effective. You give the drug, then you see if the disease happens, then you calculate the percentage. And that's why the percentage shows that if you got one of these vaccines, you roughly had 95% chance of not getting COVID because you got that vaccine, whereas you didn't get it, the percentage was higher.
Thank you. Thank you. So I'm going to go to another question. Megan, you have another for us?
Yep, we had a question from Fred, who mentioned that the logistics might make it difficult to get the second dose exactly 21 or 28 days after the first. Is there a safe range between doses?
What? And I'll start, Dr. Riley. I think, we're trying to stick to what was done in the studies, in order to get the same type of results. But, if you don't make that 28 day and it's going to be 29 to 30, CDC's, you still need to get the vaccine. In terms of knowing whether the titer is going to be different, the efficacy is going to be different, we don't know. Science and the data from the past of us vaccinating people, because remember, we as a family physician, we do a lot of vaccinations. Sometimes we want 2 months, but we don't get 2 months. We may get 3 months. People's lives change. I think that you're still going to be in the safe range if you get it a little bit delayed. I mean, you want it on time, but if it doesn't happen, you still need to get it, and you're going to get the protection you need.
I agree fully with Dr. Vasquez, because family physicians and pediatricians give out more vaccines than any other doctors that God makes. So he knows. You're right. We want people to come back on day 21, but if you come back day 22 because life happened, you couldn't get transportation to get to the clinic to get the shot. You have a sick child you got to stay home with. You miss your appointment. If you get it day 20, 24, 25, you're going to be fine. We just want you to try to stick as close to possible. Now, the CDC is studying whether if we lengthen the time period, would people have a problem? And so we don't know the data yet, but biologically, Dr. Vasquez and I feel strongly that, a week, 2 weeks may not make that much difference, because again, even after the first dose of Pfizer or Moderna, you get 50% effectiveness. So that second shot pushes you closer to 100. So that's what we ultimately want to do, try to get people above 70% protection.
Thank you. That explains a lot in terms of the second dose and why it's needed, why it's so important. So I'm going to switch gears just a little bit. So we know that CDC supports this, the development of the vaccine, the distribution of the vaccine, but we also know, as particularly in communities of color, Black and Brown communities, that there's historical trauma, there's medical mistrust, and many marginalized communities remain hesitant and concerned and even dismissive regarding the vaccine's effectiveness and its rollout for emergency use. So what steps is the medical community taking to address the legitimate concerns that marginalized communities continue to have?
Well, I think I'll take the first shot. I mean, we're creating ambassadors, right? I have 150 people that look like the community that got the shots. Nobody turned into Spider-Man. There's not no mutations. Some of us wanted that, but that didn't happen. And I think it's real important for that information and their experience. So we put videos on a lot of their experience. Some of them felt, I got very anxious. I was worried. I felt like a roller coaster. I was going up, but then when it was over, I felt okay. Or, all this information, the Tuskegee, all these things which are real to the community, you got to kind of help them kind of get past that. But I think once you get, the people that got the vaccine, not everybody was for it, but they did. They came out of it saying, wow, I'm glad it's over. It worked out for me. But a lot of education, a lot of hand holding, looking in certain communities, it's real important. Churches are big in our communities, doctors are second, politicians are third. So if they start to see that kind of a trend, it works. And I think it's more just awareness, videos, and just letting people know that, I was vaccinated. You come into the office, you can tell people, because there's that, the one thing is once you're vaccinated, I think you can guide people and give them a better example. And when you look like them, it becomes even easier.
Agree with my distinguished colleague. Look, you got two Black doctors that look like people that are in your families, African American and Latino. So look, Black doctors have a lot on the line. Latino doctors have a lot on the line. If we didn't believe in the science, we wouldn't be pushing it and encouraging Blacks and Latinos in particular to get this, because we know Blacks and Latinos have been hammered by, this virus. Dr. Vasquez's home borough, Bronx, still leads New York City in the number of cases tonight. And just think of all the heartache and pain. So if you're, listen to us, listen to trusted voices, African-American doctors and nurses and healthcare professionals, your pastors, your imams, your faith leaders, your community leaders. They know because they care deeply about the community. So we are the reason why we're doing this webinar is to answer the questions and address the concerns. And Blacks and Latinos have a lot of reasons to distrust the health system. But right now, Blacks and Latinos have a lot at stake by not listening to the health system in terms of vaccines.
Thank you. What you're saying is so critically important. And I think particularly being doctors and professionals who have seen the devastation firsthand, who've seen the loss, we do have a lot on the line. So thank you for that answer. I'm going to go to Megan again. Megan, you have another question for us?
Thanks, Louise. We actually had two questions, pretty similar, one from David and another anonymous question about any pre-existing health conditions that could make it detrimental or challenging for someone to receive the vaccine.
I'll start with that. I think, if a lot of things, no, but some things you may want to consider. I mean, if someone had Guillain-Barré, which is very rare, that's someone I would want to really go through that process. I think if you had allergic reactions, not really. We just have to watch you a little bit longer. Transplant patients, HIV patients, AIDS patients, all those individuals need to get the vaccine, so they should never be off the list. So but it's very rarely, in pregnancy, it's still controversial, because COVID has a big impact. Should we vaccinate or not vaccinate? We still don't know the data there, but other, I think it's just on a case by case. There's an eligibility format that's inside New York State. You can look to see if you're eligible and really reach out to your doctor. Because we're going to look at who you are. We know the things that you have, and we can pretty much tell you yes, no, maybe. But 90% of the time, it should be yes, because the outcome of getting this disease, it's really a bad outcome.
Absolutely. Dr. Vasquez is so right. There are most pre-existing conditions that everybody should get this vaccine. I myself am hypertensive. I have high blood pressure. High blood pressure has been one of the biggest contributors to people getting COVID. And so, yes, high blood pressure, diabetes, you've had a heart attack, you've had a stroke, all those, yes, you should. You have rheumatoid arthritis, you have lupus, you still should get it. Now, what your doctor may do if you have rheumatoid arthritis, he or she may tell you, after you get this shot, you may have to stay home a day because it may kind of get your rheumatoid arthritis a little flared up. And that happened to my sister, by the way, who's got rheumatoid arthritis. She's a nurse. She got the COVID vaccine, the Pfizer. She had to stay home 2 days from work because she was just, kind of fatigued. Now she's back at work, no problem, and she's gotten her vaccine. So generally, as Dr. Vasquez says, pre-existing conditions are the reason why you must consider getting this vaccine, not you should not.
Thank you. Thank you. You have another question, Megan?
Sure. We had somebody mention that we would be remiss if we didn't address the news related to Johnson and Johnson and their vaccine. Where in the approval process is that, and what's new about that vaccine?
Great, I'll take it first and then assist from Dr. Vasquez, of course, because I know he's really waiting for this vaccine. The J&J reported by press release today, not all full data, but sort of the headlines, that this is another vaccine that will submit its data to the FDA next week, requesting emergency use authorization. So the bullet points about this vaccine that I think is going to be a game changer. Number one, it's one shot. Number two, you can store it in your home refrigerator if you had to. It does not need to be frozen like Pfizer and Moderna. It can last in a refrigerator months, whereas Moderna and Pfizer, you can only keep it frozen for about a few weeks to a month. So it's going to be easier to get the J&J vaccine out into the community, out into primary care practices that Dr. Vasquez runs. So now the other issue, you're going to hear this data, but don't worry about this. You're going to say, well, it appears to be a little less effective than Moderna and Pfizer. The fact of the matter is, it is 72% effective in the United States. It is 85% effective in keeping you from getting really, really severe COVID. So remember, any vaccine, in particular these vaccines, the goal is number one, keep you from getting real sick from COVID, keep you out of the hospital, keep you out of the ICU, and keep you out of the funeral home. That is the reason why we want people to take this vaccine. Now, you may get COVID. You may have a little bit slightly higher risk of getting COVID with the J&J, but you're not going to get the worst COVID. So we can't let the perfection be the enemy of the good here. The only way we get this virus suppressed is to get as many arms vaccinated by whatever vaccine that FDA approves, because then the virus can't run. If it can't find targets, meaning people to infect, then the virus goes away somewhat. It goes underneath, it goes subterranean. So the J&J is going to be an excellent tool, the third vaccine that'll be much easier to get out into rural areas. And some people, we know, Black and Latino folks don't like going to hospitals generally. They don't like shots. So if you have, abuela, you finally get abuela to do the shot, but she only wants to do it once, then you give it a J&J.
Abuela and me, yes. Dr. Vasquez, did you want to add anything?
No, I think he's dead on. I think the important thing right now that we have to kind of look at is it's not the vaccine, but the vaccination is going to change the game. Mm-hmm. And we have a lot of mutations that are coming out with the virus itself. More mutations will continue to come if we don't really have an impact with these vaccinations.
So you're leading me right to the next question. Thank you for that. So there's currently there are more contagious variants of COVID-19 that have been identified in the US, from the UK, and from South Africa. How effective are the vaccines in protecting individuals from those variants?
So for the UK, which is B117, what they've done is, and peer reviewers they took the virus and they took blood from individuals that were vaccinated or had COVID, and it's still effective. So in some cases, you may not be 95, but you're still going to be in the 90 range, because even the UK, it just adapted itself to be more contagious. An example is, if you're coughing, COVID could be floating around for 4 hours in an area. This virus may adapt itself to be around for 6 hours, 8 hours. So you get more of a dose. The old COVID can go in plastic, last for a day or two. This may last longer because we're seeing higher viral counts with the UK. So it's more contagious. But the spike proteins on that one, the same key hasn't changed. So if we develop the antibodies to that, that's not going to be an issue. The South Africa, the mutation is changing, because remember, as you mutate the mutations of the amino acids inside these viruses take place, the spike proteins change a little bit. Mm-hmm. So we may be less effective with that one, maybe 60% coverage. But with this technology, the Moderna is already, and Pfizer's following, they're developing a tweak in the RNA so that you can give a booster and you don't have to do the long-term study because it's piggybacking on what it already produced with the other studies that it submitted to the FDA.
Right.
Okay.
Excellent answer. And just to give an anecdote, so many of you I know are cooks, and you get recipes handed down from your abuela and other family members. But guess what you do? Don't you tweak that little recipe a little bit? And you say, well, abuela
Absolutely.
didn't use enough salt, didn't use enough ginger. Well, you add a little more. Well, that's what these mRNA vaccines can do. The manufacturers can go back into the lab and add a little bit more that covers the variants that we're talking about. Knowing that in the main, you still get some protection from the variants. So that's the way you need to think about the vaccines and how they can be modified. It's just like modifying one of your favorite recipes that's been handed down in your family. No two cooks cook the same way. And that's why these viruses have different technology, which can be kind of tweaked. The Johnson & Johnson is a little bit different technology than mRNA because it uses a cold virus as that shuttle. Remember I talked about that shuttle, like sending an email? Well, it just uses a different type of shuttle. And again, we think that can be tweaked too. And Johnson & Johnson's already indicated that they're going to check again by seeing if it makes sense to give someone a booster of the one-shot series or to go back into the lab and do a little recipe change.
Thank you. We have another question, Megan.
Yeah, we had a question from Patricia who mentioned that a lot of people don't always believe that they can catch the infection. Even with a lot of people becoming sick or dying, there are some people who think that their age, their lifestyle, eating organic, being a vegetarian, vitamins and fitness are all going to help protect them. What would you tell someone to help make them rethink their position?
Well, I can tell you, and quite candidly, there are almost 8,000 people in New York State hospitals tonight, some of whom felt that way, that, oh, I can't possibly get this because I work by myself. I don't ride the subway, so I can't get it. I don't go to sporting events because I can't get it. I'm vegan. I can't get it. I take vitamin D and I take multivitamins and all that. But guess what? COVID doesn't care. COVID doesn't care whether you're black, white, except it does tend to like Black and Latino folks more than others. It really goes after people who are obese. It really goes after people who have pre-existing conditions. So no, everybody is at risk of getting COVID. And as particularly as adults. Now we'll talk about children later. But I know we worry about in New York State and the governor's vaccine task force, we're really focused on, we've got to get vulnerable communities. That means communities that look like us, that have been hammered. We have to get them, the adults. In the case of Pfizer, if you get Pfizer, 16 is the lowest point, 18 for Moderna. And then, the children have been comparatively less affected, but it's only a couple years that we'll have a vaccine for children probably. So that's going to follow. But remember, there's so few cases in children that we got to, focus on, what's really in our face right now, which is the high number of people who get this. But tonight, there are people in New York State hospitals and all over this country who felt just as that questioner just mentioned, oh, I can't possibly get it. And guess what? They did.
Thank you. Thank you. Dr. Vasquez?
No, I agree 100%. So, you
Right.
got to tell them the eyes can only see what the mind knows. And, as physicians, we do see all the bad stuff. And sometimes people, you don't want to experience it. You rather just learn from people telling you.
Thank you. One more question from Megan.
Yeah, we had a question from Joy who mentioned that with all the work that we're doing on calls like this, answering questions, building trust, encouraging people to get the vaccine, she's concerned that there might not be enough supply to meet the demand that we develop. Is there anything that folks think we can do to address that issue?
Well, absolutely. I got to tell you, there's been a change in Washington, and that's because we have a president of the United States, a vice president of the United States, and a head of the CDC and a COVID task force that is leaning into this. They are doing a much better job at organizing and getting the distribution fixed. You're right, we do have a short-term problem. When I say short-term, we ran out of vaccine this week, but we're getting vaccine next week. And again, if the Johnson & Johnson gets approved, Johnson & Johnson has already manufactured 100 million doses of the J&J vaccine. They have that waiting in a warehouse for the FDA to grant approval. And the president ordered another 100 million doses of both Pfizer and Moderna this week. So, right, we are in a little bit of crunch now, but I assure you, by the 28th of February, the problem won't be that we don't have enough vaccine. The problem will be we don't have enough sites and we don't have enough vaccinators to put vaccine in people's arms.
And I have to concur with Dr. Riley. I think right now it's a time to really develop the infrastructures. I think what's happened now is you haven't really gone it after the doctors. So community doctors almost are disconnected, you know? You got the county, you've got the hospitals, FQAs in their group, but our groups, which really touch a lot of lives, are not really engaged in that sort of model. So, you know, in other states, it worked out, National Guard, pharmacists, and getting the doctors involved to really access populations. I mean, we have a group, you know, of physicians that we manage anywhere from 30 to 50,000 lives. And those are the individuals that if we had the shots, we can easily work through the process. And also the doctors, the primary care doctors that are out there, the lack of primary care is why we're in this situation. You know, if we had better primary care, if you're managing the blood pressure, the diabetes, these individuals did not have a lot of receptors in the lungs to catch COVID, you know? And so really getting at the core of health equities, which is the lack of primary care in these communities. And so if we have that, I think it's the vaccine piece becomes another piece. But you know, sometimes we get caught up in looking at the problem and not the solution, but it's really encouraging more primary care in our communities. Most patients don't have that. So they don't have that tie with someone they trust. So the testing is one thing, but this vaccine, it's a real partnership. And they, you know, they still trust their doctors.
Absolutely. And we need a lot more good family medicine doctors like Dr. Vasquez. And I think my hope for him and for his patients is that within a couple months, they'd be able to just walk into any one of his offices and get a shot. Right today, he can't do that because he doesn't have enough vaccine. But like I said, within a few months, that's going to be a reality under President Biden and Vice President Harris, is that they're going to get this distribution problem fixed. Just announced today that the Secretary Austin, the new Secretary of Defense, is going to deploy 10,000 National Guard to give out shots. That is going to be very helpful to get National Guard to give shots in addition to people like Dr. Vasquez and his staff.
Thank you. We have just 2 minutes left. So this one, we're going to wrap this up in a nice bow, right?
We're just getting started, Louise.
So you've already alluded to this. So in 30 seconds, can you tell me why it's important for more individuals to support and take the vaccine? We've kind of circled it. So just let's wrap it up in a nice bow.
I'll tie it up this way. Look, we were all fond, many of us, to talk about Black Lives Matter back in the summer. But I'm here to tell you tonight that Black and brown lives matter, and science matters to Black and brown lives.
Thank you. Dr. Vasquez?
I think we could see the devastation in our communities. I mean, you were talking about the Bronx, 3,700 people died in their homes. They're scared to go in. So, you know, this is the only way out. The vaccinations, we have some treatments, but there's really nothing once you get it. So, you know, I gave it to myself, my wife, my daughters are medical students. They were in front, they got it. So I gave it to the people I love because I knew how that important it was. And we did you know, Dr. Riley and I did our homework. We just didn't go in there and say, okay, we're going to take the shot. There's a reason why we did that. And we've also had people in our lives touched by this that are no longer here this year.
Yes.
So I think you have to really look at the long-term reason why you do this. But if you don't do it, it's you know, not only do you affect yourself, but you affect people that you love around you, because that's how COVID got everywhere. So the vaccine is doing the reverse to really protect yourself and your family.
Thank you so much for that. And that's perfect. It's true, everything that you said, and the people on this call are doing their homework there by tuning in and listening to the answers that you've given to the questions. So thank you for being here. Unfortunately, we weren't able to get to all of your questions, and I apologize for that. But in the chat, you'll see a link to a document of frequently asked questions. We think it may address some of the questions that came up in the chat and tonight. So please save that link for future use, because as we get more information, we will continue to update that document. So thank you to our panelists. You all were awesome. Thank you so much for your patience, for the time that you took to explain. And thank you, all of you who tuned in tonight. This was recorded, so it will go out so that others from the task force will be able to hear it. So thank you again. Enjoy the rest of your evening, and we look forward to the next Fireside Chat. Thank you, Dr. Riley and Dr.
Thank you.
Vasquez.
Be
Thank you
safe,
so
all.
much.
Be safe.
Have a good evening.